went to college at a small school in the Cleveland area called John Carroll. It's a Jesuit college. And then I went over to University of Toledo to complete a master's degree as well as get my medical doctorate. And then I went to St. Joe's, both in the Ypsi area as well as in Brighton and Howe, Michigan, and Ann Arbor to do training in family medicine. So what that kind of means is I see people, infants all the way to 100 plus, trained in delivering babies too, which I no longer do, thankfully. But it was a good experience. And now my wife and I live in the Ann Arbor area. She's also a physician, where we met at University of Toledo, and she does neurology stuff. We have a 10-month-old daughter, so she actually slept a little bit last night. This is a little, probably the most awake I've been in a few weeks, but I'm happy to be here. All right, so today, kind of focusing on talking about health, men's health, but also just health in general. And some things that are super common that I feel like are important to know. Some things you may know all of this already. Hopefully you learned some of the things from it. But I see patients pretty frequently where they'll come to see me after like a hospitalization, or maybe they haven't seen a provider in 30 plus years. But that's fine, Anytime that getting back in touch with healthcare, I think is a good move. Ultimately, I tell patients when I see them, I like to see at least once a year for a physical. And that's kind of my goal. And the reason is because if you go too long for certain conditions, high blood pressure, diabetes, cholesterol issues, which we'll talk about a little bit here, it's something that the analogy I kind of tell people is you're on a train track, and there's a train coming. We don't know where it is or how far away it is, but eventually, if you don't move off of it, it will hit you. And so, if you have things like diabetes, high blood pressure, and a lot of these things you can't know or feel necessarily, then it's something that probably should be addressed sooner rather than later. So let's kind of start with blood pressure. It's a very common thing, Doesn't happen to individuals who are just overweight. It can happen to anybody. There are ultra marathon runners, so people that run 50 miles a day. They eat the healthiest diets, and they have wildly uncontrolled blood pressure. Because sometimes there are certain things that you can do to help, and then other times it's just the hand you get dealt. It's part of your genes, and so it's no fault of anybody's whatsoever. But as far as like a risk standpoint, it's a good idea to at least make modifications if you can, and then if you can't, there are medications that may be able to help. So, yes?
I'm one of those men that didn't take care of myself. Now I'm 66 years old, and I take 2 high blood pressure pills, and I'm also diagnosed as pre-diabetic. So since I'm going to stay here a little longer, if you have any advice for me, aside from taking medication and changing my diet where I don't eat the things that could bring on diabetes.
Absolutely. Yes. That's a great question. So let's talk about essentially both of those things. As far as the blood pressure goes specifically, and when I say there's lifestyle things as well as medicines, let's talk about what even is high blood pressure, what's considered that, and what would be the goal. So for most individuals, the goal is, if you don't mind, can I write down?
You got that up there for you.
So the goal would be, there's two components to blood pressure. The top number and the bottom number. One's called systolic pressure, which is the top number.
Also, while you're talking, feel free to make it known that it is a difference when it comes to high blood pressure of people of color.
Yeah.
In our church, we talk about everything, so let it all hang out.
So, yeah, and that's especially true for people of color, specifically black individuals. There is some elevations more often than not for black individuals over people of other races. And there's a lot of debate as to why that is. But in general, you do see higher blood pressures in the black population. And so, regardless of race, the goal for blood pressure is 140 on the top, and you'll see it written like this, over 90. So what these numbers represent is, it's a measurement of the blood pressure. I think it gets measured in like millimeters of mercury or something. But systolic is when the heart pumps forward. And when that happens, the blood pressure rises. When it relaxes, that's the diastolic, which is the bottom number. But if it's above either of these on a consistent basis, it's recommended to try to lower that. And this isn't just like my recommendation. There's a lot of studies, not just through like the American College of Cardiology, but also through plenty of different analyses, also through like neurology, family medicine, things like that. If individuals have diabetes or other certain conditions that make it more prone for them to have other vascular issues, then it's a slightly more controlled number. So with diabetes, the goal would be 130 over 80. So how do we know what it is? Because blood pressure fluctuates, it changes, it goes up and down. After you eat, it would go up and down. If you're in pain, it increases. You know, exercising, lifting weights, walking around at different parts of the day, it always changes. So it's okay to temporarily be above these numbers, but consistently, one of the most effective ways you can measure it yourself is with a blood pressure cuff. Now, a lot of these are usually like $20 or so. Sometimes they're covered by insurance. Arm cuffs are more accurate than wrist cuffs. If you do it once a day, in the morning, after you go to the bathroom, but before you eat food, that gives you a very good idea of how you'll run most of the day. And so, if you find that you're consistently above this, or this, if you happen to have diabetes, then it's something that you likely should make some kind of change for. And then we'll talk about the changes you can make for blood pressure. Yes.
But what happened to me, I got a new doctor,
Yeah.
and that doctor kept saying I had my blood pressure. So I went to the lab, and that bag goes in. She said, please, you gotta help my blood pressure going down. So now I'm on 2 pills for the high blood pressure. I don't have a problem at all. Should I feel secure because I'm taking the medication that I'm okay? Or
It depends what yours personally is. You know, I would say if you're consistently lower than this, and we'll talk about a couple other things, because everything is a risk versus benefits thing, right? You know, the risk, all medicines do have side effects. That's not a lie.
Right.
Most of the time, people don't experience them, but sometimes people do. But if you're on blood pressure medicine that brings this down, and we'll talk about cholesterol a little bit too, but if the cholesterol is looking okay, and the pre-diabetes is also fairly well controlled, your chances of things like heart attack or stroke, kidney issues, go down dramatically.
Thank you.
Yeah, absolutely. Yes.
Can you can you tell them about the classifications of blood pressure medicine?
Absolutely. So there's a few different classifications. And as far as, you know, African Americans, Black individuals, there are recommended ones that for Caucasian or white individuals, there's a slight difference in one of the classes. And that's true that we've seen that with studies. The main first-line agents for blood pressure medicines are something called thiazide diuretics. Those are things like hydrochlorothiazide, orthalidone. There's a whole big list. There's an additional group called calcium channel blockers. Things like amlodipine, nifedipine. There's other ones too. Those are first line for basically any race. There is another one called an ACE inhibitor. Things like lisinopril, enalapril, ramipril. There's tons of different ones. It ends in pril. All of the medicines have like similar endings or sounding names in some way, so you can kind of, if you see it enough, recognize maybe what the class would be. That is something that has not shown as good of blood pressure reduction in Black patients than it does in white patients. I don't know the reason. Is it something that still can be used? Absolutely. But sometimes, for whatever reason, it doesn't make sense to me mechanistically why that would be. But that's why they do a lot of trials on it and see. Those are the main types, but there are many other types. And there's other medicines that can bring down your blood pressure if you had heart issues. One thing is called like a beta blocker. You'll hear metoprolol, atenolol, esmolol, things like that. That can bring down blood pressure too, but it has an effect where it slows the heart from pumping as much. And the thought is after a heart injury or things like that, it can basically let the heart rest a little bit longer to build up force so that it can pump it through more effectively. Because over time, this is something that you might have blood pressure issues for 10 years, 15 years. It can harden the vessels in our arteries. It can make them less elastic, less stretchy. And also, with cholesterol and sugar issues, can put plaques in our vessels too. If a plaque breaks off and travels somewhere, depending on where it travels to, that would be a huge problem. So if a plaque breaks off in the vessel and travels to the brain, that's essentially what a stroke is. And so to try to prevent the buildup of these plaques, to prevent the hardening of the arteries, that's ultimately what blood pressure, it being high over a long period of time, does, as well as high sugars can do these things too, and also higher cholesterol levels. So, as far as, let's say somebody has a blood pressure that's 160 on the top, or 170, something like that. Or if they just have it 100 on the bottom, or 105. And they have that maybe for 10 years, and they don't really know, because you might not feel anything. Over time, you might have hardening of these vessels. And if you think about it, if they narrow down because they're getting plaques built up, if you put your thumb over like a garden hose, let's say, that pressure increases and shoots out. And so over time, it's almost like a cycle. It makes the pressures continue to build up on themselves. Now, what can we do about it, right? Because some of it you can do something about. One of those things is through lifestyle changes. What do I mean by that? Well, one of the things is weight reduction. And I'm not talking about even like 20, 30 pounds. Even like 5 pounds, 5 or 10 pounds can significantly improve the blood pressure. By significantly, I mean usually like up to 10 points. So if you're 150 over 90 and you lose 5 to 10 pounds, say you lose 7 pounds, you might be at the perfect range. It might not need medicine. Yes?
Even if the individual is as skinny as I am now.
Yeah.
If I lost 5 more pounds, it would help me live.
Well, it's not for everyone.
Oh,
You know, and certain times, you know, if you're at a healthy body weight already, other things you can consider. When these are additive too. So one thing is just walking around more. Like if you don't exercise, 30 minutes of walking a day, like for 5 days a week, might bring it down another 5 points.
Yes.
Limiting salt. So there's hidden salt in a lot of foods, even foods that are good for you.
Right.
You know, you look at the salt content of like canned green beans, it's fairly high. If you look at all of the labels, they're required by law to put nutritional labels on most foods. Limiting it to less than 2,000 milligrams, really 1,500 milligrams of salt per day might drop it another few points. Doing all together might bring it down. Now we talked about those ultra marathon runners. So those are the people that they might eat salad without dressing every day. I mean, they're really, you know, pretty wild about some of these things. And they might have very low body weight, exercise all the time. Their blood pressure might be 180 on the top. And it just is something that runs in families. It's very common. So what do we do about that? Well, we put them on a blood pressure medicine. And hopefully their risk of then developing kidney disease, eye issues later than night, heart attacks, strokes, things like that, reduces by doing that. Sometimes people need more than one, unfortunately. You try to do one, you try to go up to the safest, highest dose of that medicine. If you can't do it with one, you might need two. Some people need more than that. Yes?
You know, with me, if it's not enough seasoning, I add more, which is a mistake.
Yeah.
So I'll put more salt on something than it probably needs, and more sugar in my drink. So that's why I got high blood pressure. I'm pre-diabetic.
Again though, some people eat tons of candy all the time, and they don't have sugar issues.
Oh, you know?
Some people don't.
Oh.
Some people can be very overweight, have poor diets, and their blood pressure and sugar is okay. It's a combination. It's a combination of the decisions you choose to make, but also what is inherently in your genetics. And so part of it is something you can control, the other part isn't. And if that part isn't, is something that makes it more prone for you to have bodily injury later, it's probably a good idea to at least have this monitored, because if you're falling into too high of a range, might be something to intervene on. And again, one of the ways you would know is to either check it with the arm cuff, or to see a provider, to see a physician or any other primary person if you're having concerns or issues about it.
But I appreciate your time, and other men here, You know, I appreciate what you shared.
Thanks. Well, let's talk about sugar too, because you brought up a good point, pre-diabetes, right? So what does that mean, right? We hear it all the time, but people check their sugar sometimes if they have diabetes or sugar issues. What is that? I'll go right on this one. So there's something called an A1C. It stands for hemoglobin A1C. And if you want to know any of like the very specifics, just please ask me. But essentially what this is a measurement of your blood sugars over a 3-month period of time. So it's not like in the moment they get a blood sugar and tell you, this is how your blood sugars are usually run. So I see it like this a lot of times, A1C. What is prediabetes? Prediabetes is a measurable level, 5.7 to 6.4. That's the range for prediabetes. And I'll put DM. So DM for me stands for diabetes mellitus. It's just the full name of it.
What do you mean by range?
Range. So it can go from 5.7, you would be pre-diabetes. 5.8 you would be, 5.9, or anywhere in the numbers between that. So when I say a range, it's like from the low range to the high range. This would be in the pre-diabetes area. Diabetes itself starts at 6.5, and it's also a spectrum or a range. It goes beginning at this, but it goes all the way up to essentially unmeasurable. Most machines in our offices will measure it up to a level of 14. 14 is fairly high. In fact, there's indication to be on a medicine called insulin when you're above 9. And so if you go closer to the 14 range, this gets a little concerning for developing visual changes. And most people know of individuals who have diabetes. Sometimes you have kidney issues. You run into dialysis, potentially, amputations. This is not something I'm trying to like scare you with or anything. It's just what realistically happens to people, you know? And so what can you do about this? Same thing. If you improve diet, one thing is lowering how much excess sugar you take in. But sugar comes in many forms. I don't mean just like pure sugar or candy or other things. Some foods that have a lot of like sugar in them, bread, pasta, rice, things that I love, fortunately. But if you don't limit those things, or add in other things like vegetables, even fruit, even things that are healthy for you. Like an apple has a fair amount of sugar. So if you're drinking a lot of apple juice, certainly non-diet pops hold a lot of carbohydrates. Carbohydrate is another name for sugar. So potatoes are great. I love mashed potatoes. I'm gonna have some this Thanksgiving. But, I need to limit myself, or else your sugar levels can rise. And again, some individuals will have no problem with this. They might not have it in their family. They might not have this history. But sometimes you do. And you could walk around and not know it necessarily. Your A1C, this value that determines prediabetes, diabetes, where are you on that spectrum? People walk around sometimes at 11 or 12. And even thin individuals, things that you might look at someone and you're like, they have diabetes? Like, I'm surprised. It just happens. And so that's an important thing to be aware of. Yes?
I spoke with someone that had went through emergency found out they were diabetic, but the doctor knew without testing them, like a stench or a smell that came from their body.
Yes. So sometimes you can get diabetes where you have very high sugar levels. And if you have very high sugar levels, it's not always this term, but there's something called diabetic ketoacidosis. And what happens is your body goes into ketosis, which means it starts breaking down ketones, which are a different form of fuel. Usually sugar is our form of fuel, but sometimes it breaks down other products. And when it does that, when your sugar levels are very high, your body's kind of in a like starvation mode. It sounds a little counterintuitive, but you can have this odor in your breath. Sometimes people describe it as like a banana smell, like the fruit bananas. It smells differently sometimes to other individuals, but when that happens, they're fairly sick. And sometimes that's how people show up to the hospital. I remember this one woman. She was in her 50s, and the first time I ever saw her, she was almost unconscious. Her bladder was the size of a watermelon, because over the years, it had stopped functioning normally. So her nerves got damaged by her sugar levels, where she wasn't able to urinate. And she had this. It was diabetic ketoacidosis. Her A1C, I want to say, was like 13, but she didn't know. And I can't tell you when that would have happened. At least 3 months, because it's a 3-month measurement, but probably like 10 years or so. Hadn't seen anyone in a long time. Eventually, this person needed a heart catheterization, and they had to put a stent in one of her heart vessels because it damaged her heart over time. She's doing actually very well now, as far as I know. The last time I saw was about a year ago. But her A1C, she made some dietary changes. She's on, I think, only one medicine now. And it's close to 6.5. When someone develops diabetes, their goal should be under 7. Lower is better, but there are individuals also who I have seen that have had a heart attack, found out that they had diabetes, made significant changes in their lifestyle, and came off of medicines. They didn't come off of medicines for their heart protection, but they did come off of all medicines to help control sugar. So you have a very powerful ability based on diet alone to be able to potentially control this. I would say, as far as blood pressure, sugar, and cholesterol, this might be the most modifiable thing that people can do in terms of lifestyle changes. Even things like, if you like, some people don't like the taste of Diet Pop as much. If you drink like 4 or 5 sodas in a day, and you change, and you even drink, let's say you cut them in half, or you take some diet soda and add it to your regular soda. Now there's issues with diet soda too, but just by doing that, taking that excess sugar out, might significantly improve your blood sugars over time. So, the other thing that I would say, because these all kind of go together, and they go together in a way where these are extremely common for, frankly, I see more men that have these issues, but women can have them too. The other thing would be cholesterol. So that is something that's very linked to family history. People will know. Yes?
Every once in a while, I get that itching inside of my feet,
Mm-hmm.
and the way I get rid of that is I got a pan all like that, and then I fill it up with hot water as hot as I can stand,
Okay.
and then put some soap, Dawn soap in there, and in a few minutes it's all gone. And then I get, once in a while I get the Charlie horses,
Charlie horses? It depends on what the cause is. And again, so Charlie horses, let's say, because people get muscle cramps a lot. It can be from iron levels, it can be from magnesium levels. There's a fair amount of things that can cause it. Can be something called restless legs if you get it more than that.
What medicine you use to get rid of it?
Depends on the cause. And that's another reason to see a primary physician. Because in order to determine what medicine might be helpful, or what things that you can personally do to alleviate it, they might have to draw a blood lab to see what your levels are. If they find out that, your magnesium level is super low, something in general that probably won't hurt is taking some magnesium for that. But let's say your magnesium levels are low or normal, and you have iron levels that are low for some reason, and then you take some iron and that improves. And again, part of the reason seeing probably once a year should be sufficient, unless you're having, let's say, diabetes that wasn't quite in range, or other issues you needed to follow up on, would be for them to try to figure that thing out. And they would obviously fully discuss, depending on the cause, how to hopefully help you with that. It's hard to say for sure without knowing like specific laboratory values and everything though. It's a good question though.
Well, I had trouble with my feet, it's itches on the inside. That's the only way I get rid of it, that's the way I get rid of it, which works all right.
I'm glad that helps.
But sometimes they put salt in there and have salt water in there. Whichever way it does it, it works.
Good.
If it wasn't the Charlie horses, when you get Charlie horses, them things hurt.
Yeah, I'm sure they do.
I just wonder if there's a better way, some way to get rid of it.
I don't know. It's something I absolutely would bring up to a provider though, because if it's something that can be easily adjusted, either with the change that you make or with a certain medicine, then hopefully it's a quick fix. Sounds like you've found a method that's been very effective for it, but you might want to look into that. Yes?
What about kidney disease? At what level on BUN do you get concerned and what do you do about it?
On the BUN rating. So he's asking about kidney disease. So it depends. It depends on.
Okay, my BUN rating has been consistent, 27, 29 for the last few years.
Okay.
It's gone to 30.
Yeah.
Now, where I read it say 30 means stage 3 kidney disease. That sounds scary to me.
The rating of kidney disease is not based on the BUN. So BUN stands for blood urea nitrogen, and it's really, it elevates when you have some kidney dysfunction most of the time, because it's something that the kidney should be able to filter. The stages of kidney disease are based on what's called GFR. That stands for glomerular filtration rate. Essentially, it's these like little tangles in your kidneys that filter your kidneys.
Mine's off a little bit.
Yeah. And people can have, kidney disease for a very long time. If you want to see the stages, greater than 60 is essentially not kidney disease. And it's something that can fluctuate too. Fluctuates with fluid status, whether or not you're dehydrated. Sometimes there's other things about your kidneys, but long-standing blood pressure, diabetes are things that can affect it. So
high blood pressure for a long time.
So keeping those well controlled is something that will help prevent further worsening of the kidneys. Now, if you talk about stage 3, let's say, because that does sound scary. Stage 3, oh no, what is that? It's all, again, based on the GFR. Once the GFR goes below 60 into the 59s, you're already in stage 2. You get to stage 3, there's 2 stages in 3, A and B. B is when you're a little closer to between like 30, 35 of the GFR. B is slightly higher than that in 3B. I have seen individuals though live in stage 3 kidney disease for 40 years.
Well, that'd be good.
Yeah, and it's something that making sure, again though, I see that when their blood sugars are well controlled, their blood pressure is fairly well controlled, but as far as like stage 3 before stage 4 or stage 5 where you can't produce urine, where you need dialysis, there is a huge range, huge area before that. And so having that alone by itself is usually not a concerning thing, but it is something to think about if your blood pressure is not as optimal as it should be, or as it could be to help prevent furthering of this.
Blood pressure's real good now since I've been on this.
Excellent. And there's certain medicines that can help protect the kidneys too. One of those, you know, sometimes your kidney lets out too much protein. There's medicines that help with blood pressure that can help with that as well. And so even just checking in with those blood labs, usually they'll do a full panel during what's called a physical, or sometimes after the age of 65, it switches over and Medicare pays for it. So a Medicare wellness visit, it's something they recommend at least once a year, sometimes sooner, if you need to be seen sooner, if you have really high blood sugar levels or other things too that are going on. But it's an important thing once it's in range, the protection level, the chance that things are gonna be worse because of that, it's never zero. Up to the general population, you know, 5% of people, even with everything optimized, have strokes. But it makes it down closer to that level where you have a decreased chance of worsening things to occur. Yes?
Yes, I'm just thinking, just in general, are we getting more healthier overall or less?
As a population?
Yeah.
So as a population, it depends on how you measure that. So if you measure that by like lifespan, it was increasing, really basically up until this point. There's some debate in the last year or two with different pandemic stuff going on as to whether that's stagnated or maybe even slightly declined. But this is again overall mortality. I would say as it's hard to say for like the individual themselves, but the more that medicine advances, I would expect to see longer and longer on average lifespans in general. It's a good question. I don't have that specific number or data though, so I'll look into that. But going with, you know, the blood pressure, the sugar, cholesterol is a big thing too. Individuals that have sugar concerns, diabetes, it's recommended to actually be on a statin now. That's a medicine that helps with cholesterol. Now you look at any medicine, you're gonna see plenty of negative things, probably positive things too, if you look it up. But what statins do is they lower cholesterol. They also stabilize plaques in the vessels. Because we talked about if a plaque breaks off and goes to the brain, it goes through the heart. That's what a stroke or a heart attack is, respectively. So these help stabilize those plaques. You happen to have them in your vessels, and it's suggested everyone, even in their 20s, starts developing this in the United States. And blood pressure, sugar issues just happen to make them come more quickly. And so it's something that is protective. We do something called an ASCVD risk calculator. That stands for atherosclerosis and cardiovascular disease. We can actually tell you, based on a lot of studies, what your percent chance of having a heart attack or stroke is in a 10-year period of time. And they do that by race, blood pressure, by your cholesterol levels, specific ones in them, whether or not you smoke, whether or not you're treated for blood pressure, and it spits out a number. In my clinic, I don't even talk to people really until they're over a 10% chance. It is frankly heavily weighted by age. And so the older you get, just because you are more likely to have heart attack or stroke as you age, it spits out a higher value most of the time. But if your number is greater than that 10%, a 1 in 10 chance of having it, sometimes I see 25%, 1 in 4 chance of having heart attack or stroke. Because of these values that if modified, because they will give an optimal level, an optimal chance of what it is, if some of these things are brought down into a good range. Maybe if somebody was smoking and they stop smoking, which is hard, you know, but there's different things that you can do to help with that, to talk to a provider about that they might be able to give you some assistance in some of these things. And so if you're able to bring those down, your chance of 1 in 4 might go to 1 in 20. Yes?
Good and bad cholesterol.
Good and bad cholesterol. So you'll hear that quite a bit. What are those? One, when you think about the good and bad cholesterol, LDL, that stands for low density lipoprotein, that is considered the bad cholesterol. HDL, high density lipoprotein, is what's considered good cholesterol. So again, all of these are found in a blood book, in a blood value. Most of the time you need to be fasting to get this done. But if your HDL is under a level of 40, that is something that is not as optimal maybe as it could be. There's a couple ways to bring that up. One of the only ways that we can actually modify that is through exercise, and this doesn't have to be, you know, let's go out and lift hundreds of pounds. This is even things as simple as walking around. You know, walking around more than we normally do, because a lot of people have busy lives. They're running after kids, they're going to work, they do physical jobs. This is something you dedicate another 20, 30 minutes to 4 or 5 days a week. That number might go up. Statin medicines can do it as well. LDL, if you get, and there's certain indications, lower is better, under 70 is really optimal. It doesn't need to be controlled to that number, and part of that is with that ASCVD calculator that I mentioned earlier. But if you have a level of 190, that is the indication by itself to be on a medicine for cholesterol. It's one of the harder things that you can bring down yourself, but it is possible. Ultimately, if you have a plant-based diet, that is the healthiest thing you can do. Now, I obviously don't eat a plant-based diet, but even small changes, you know, substituting maybe a vegetable for this meat at a meal, even a couple times a week. Any little thing that you do can have additive benefits. And so really it's just do your best. The other thing that I'll say as far as these things that are important to control would be different screening tests. Those are things like colonoscopies. People hate colonoscopies. They say the prep is the worst. That's always what I hear. It's basically like a combo of Miralax and Gatorade, and you let it run through you. So maybe take the next couple days where you're not gonna have anything to do. But then it is extremely important. It's extremely important because if they find something, they can intervene on it. This is what the screening is. Usually people do not know that they have something like colon cancer unless it's too late, you know? It's indicated to get this, and this was a recent change. Recent is within the last probably 1.5 to 2 years, to start screening individuals at 45 for colon cancer. There's things like Cologuard too, which is a stool sample. It's frankly not as good as a colonoscopy, but if it is an alternative, I will say that is approved by the FDA. I would recommend a colonoscopy. If it was a Cologuard versus nothing, I would do a Cologuard. If it was positive, then you would have to get the colonoscopy. But especially in individuals that have cancer, colon cancer specifically, if you have a primary relative, and that is mom, dad, brother, sister, that has colon cancer, or have had it, you should get screened 10 years before they had any symptoms, or any, they were found to have that. So like my grandfather has colon cancer, had colon cancer. So 10 years before he developed it, my mom, because it was on my mom's side, needed to get a colonoscopy. You know, you hear about this all the time. As far as like, you know, even just in popular media, you know, with Chadwick, Black Panther, right?
Chadwick Boseman.
Yeah, and that's at 39, I believe, 39, 41, passed from colon cancer. It happens more frequently than people realize. And so again, this is not trying to scare, but this is, you check in once a year or so, might make significant difference. Yes.
Word of encouragement to everybody. When I was 27, I had a colonoscopy. Worst experience in my whole life. I hear people saying that if you don't have this done when you get older, you'll die. And it was like weighing colonoscopy death, I'll die. I did, after I turned 60, have it again. Obviously, they were not shoving a water pipe up my behind.
Mm-hmm.
But they were using propofol, Michael Jackson's favorite.
Yeah.
The experience is not horrible anymore. And, you know, I now I have to go about every 5 years, but because their technique and the medication that they give you, you don't feel the pain and discomfort that you used to. So, you know, it's not a horrible experience anymore.
Good. I'm glad that that was your experience. Yeah, I would say we've come a long way in that, for sure. Yes?
My question is probably one that you deal with a lot. Because of the different things we're talking about here today, you have the insurance industry that chooses and picks what medications that they allow to be approved. And I can imagine as being a doctor, writing a script, giving it to a patient, and you're getting a call right back, they won't approve it. You write another one, they won't approve it, and you know, you're kind of stuck and you're trying to do a lot of different things. How do you handle that? Even today, I think it was on CNN, I was watching, they said that the Ozempic that is used for diabetes is now being prescribed for weight loss. So now people that are diabetics can't get the medication they need because they're using it for weight loss now.
Yeah. That's a great question. You know, there are certain medicines that are first line, like recommended above all else, that are very expensive. And there are some that are very inexpensive. I will say it depends so much on insurance, and it's hard because they don't tell us either. One thing I will say in general that's extremely important is if you do not have insurance, but you're eligible for things like Medicaid, Medicare, please sign up for these programs. They are invaluable. A lot of times if you establish with a office, there are different coordinators there that can help you sign up for them and get on these benefits. So in case something were to happen, you aren't responsible for majority of these costs. But going back to your question, it is frustrating. It's extremely frustrating. I have my first line stuff, and then I have about 5 different tiers of things that I decide to do. Certain medicines that usually are very expensive, different forms of insulin, can be. There are other forms that are very effective that are less expensive though. They even sell it now, I believe, over the counter at some Walmarts. And they sell it in a form called 70-30, which is long-acting and short-acting combined. Even if you go to do those things, please touch base with a provider that can help you navigate it with the costs. But there are certain assistance programs for different medicines. There's things like GoodRx, which is something that can help lower costs for people. But ultimately, our healthcare system is not as optimized as I hoped. That's about as nice as the way I'll put it. Regardless of that, there are different tier systems a lot of times that insurance companies have, and people will have access to these. You can even ask them for yours, and they'll say tier 1, 2, 3, 4, 5. 5 is exorbitantly expensive. 3s are even usually pricey. So you can control blood sugars with tier 1 and 2 medicines. Are they as good as some of the newer ones in the tier 3? Frankly, no, they aren't. Because some of those other ones have newer studies that show more benefit for heart and kidney protection. That's just the reality of it sometimes. But once you have these, after they get, there's different ways that corporations and insurance companies can do things to extend life of patent. This is kind of getting into it. but if you have a drug that goes to market and they don't change these things, they can become generic after a certain amount of time.
So like in a year.
What?
Some people were saying like in a year.
Hopefully, yeah. Usually it's like 10 years from when you start the initial research and it goes to market to become a generic, as long as they don't change some key component of the medicine. And again, this is kind of getting into it. I think the ethics of that are questionable, but it's just our reality. And so you have to know some of the other medicines that might be able to be less expensive and still be able to work with them. That's kind of how we navigate some of it. And also there's things like prior authorizations, where we have to contact the company and fight with different things, but we do that on our side. So hopefully you don't have to do that as much, but it is very frustrating. It's a good question. Yes?
My question is going into the, when you was talking about A1C.
Yes.
And with the blood pressure, because I'm 38, of course, I've been on metformins.
Sure.
For 3 to 4 years now. Now, I didn't take it for diabetes because they told me I was a pre-diabetic.
Okay.
Now, I don't understand pre-diabetic and diabetic because I'm like, every time I go to the doctor, my doctor says, how are you not a diabetes person? I'm like, I don't know, you tell me, you the doctor.
It's an interesting comment from the
I'm
doctor.
taking metformin and it seemed like it's not working. You were talking about genetics, like, I mean, because I stopped taking it now. They told me it was supposed to help me lose weight to keep from becoming a diabetes patient.
Sure.
I'm like, I ain't seen no progress. I've just always been a stocky guy.
This is a great question. You know, and fortunately, you know, people will get different benefit from metformin, let's say for instance, than others. A lot of times you can tolerate it up to the point, unless you have like diarrhea. It's one of the side effects a lot of times. And so, pre-diabetes, which again, is that 5'7" to 6'4", there are a couple medicines that you could take for pre-diabetes. Metformin being one of them. I think Ozempic just got approved for pre-diabetes possibly too. But outside of also diet changes, things like that, do you need a specific medicine for pre-diabetes? Maybe not. Some of the medicines that you might consider would be on other risk factors too, like blood pressure, cholesterol levels, things like that. If that puts you at a high enough risk, whereas you might have like heart attack, stroke, things like that, probably a good idea to be on it. But pre-diabetes by itself with the metformin Again, I don't know like your specific diet, other things like that. There are definitely some modifiable things, but some of it is your genetics. Even with showing up to a yearly physical, to get this rechecked, to make sure it's not slipping into the range of diabetes is probably a good idea. Because, let's say you're pre-diabetes today, hopefully not, but if you show up one time and your level becomes 7 for an A1C or 6.8, you go into that range of actually having diabetes. There are other medicines that would be covered that should be approved that might help. Metformin is still a first-line medicine, but sometimes individuals will have type 2 diabetes that turns into almost type 1. It's another reason to get it checked, because metformin is first line for type 2 diabetes. And when I was speaking about that, that's kind of what I should have previously clarified. There's also something called type 1 diabetes. That's the kind you hear more in kids, but it is something that adults can develop. And what that is there's different antibodies, which is something that you think is normally a good thing. If you develop antibodies against infections, when you happen to get that infection again, it helps protect and eliminate that from your body more quickly. But sometimes there are things called autoantibodies. And that is when your body, for whatever reason, goes and attacks different cells in your body. And if it attacks the cells that produce insulin, that's essentially what type 1 is. Again, it's hard to say. It's something that diet absolutely matters so much for. And if you were only taking like 500 milligrams, which is like 1 pill once a day, you might not notice as much of an effect. Without knowing like specific values, it'd be hard to say more into that specifically, but that was a very good question. As far as one other thing for screening, I just want to talk about immunizations for a second too. Now you'll hear, even before like it got politicized, or politicalized maybe, with like COVID vaccines, there are other immunizations that people could be due for if they wanted them. I personally recommend them because I've studied it and I believe it. But it's something that you have to see if it's right for you. Like things like the flu shot, Again, everything is a risk versus benefits. What's the chance you're going to get the flu and end up in the hospital? It's small. It is. It just frankly is. I've seen 30-year-olds and 40-year-olds almost die from it and be intubated and hospitalized and when they didn't have the flu shot. But it's not like I see that all the time. Even if you get the flu shot and it's not the strain that they predict for that year, it still usually helps mitigate the symptoms. As in, you'll feel less sick if you happen to get the flu shot. But as far as total prevention, that's just not a thing. Same thing with COVID, It's a risk versus benefits. Personally vaccinated, because I saw a lot of people die from it. Because I worked in the ICU for 2 months before we had vaccines and everything. So we saw people every day die. But it is what it is, As far as even now, I see people with COVID every day. There's a lot of RSV going around. We don't have a vaccine for that. Even I've heard potentially next year we might. Influenza though, something that I've seen only one case of so far this year. Something to consider. As we age, there's different ones you might want to think about too. When you get over the age of 50, shingles vaccine, it's called Shingrix. 2 doses, you're set for life. Why it's even a deal? Shingles hurts. It hurts if you get it on your skin. If people have had it, or if you know someone that's experienced it, you can have it. But that's not the reason we have the vaccine. Most of the reasons is because on the off chance of something terrible happening. as in like shingles can track back through your eye and cause something called meningeal encephalitis, and you can be permanently blind from it. So they exist for a reason, but it's something you should talk with your provider about, and they should offer you a reasonable explanation for anything that you do. If they can't tell you with some understanding on why you should or should not do something, maybe go talk to somebody else. But like, that should be something that they should be able to answer all of these questions in a way that makes sense, or else they probably don't understand it well enough. Just as a, yes.
Yeah, I had shingles,
Yes.
and it was annoying. Not as bad as when my mother-in-law had it. It was very, very bad for her.
Sure.
I later got the first part of the vaccine, didn't go back for the second part, wound up getting shingles again. Do I have to start over again, getting part 1 and part 2?
I believe you do not. I am not 100% sure. I'd have to check, but I'm almost positive the answer is no. Usually you get the first one, and then you need to wait 2 to 6 months before getting the second one. But there should not be, there are for some vaccines, I don't believe there's a particular time component as far as like if you haven't received the completion of the course, you would need to restart it. So I'm fairly certain that you'd only need 1 more and then you would be set. It is unusual to get shingles a second time, but it's not impossible, especially with things that make your immune system lower, things like diabetes specifically, but also if people have other underlying things. But that's unfortunate. I'm sorry that happened. Yes.
I needed your opinion on this new medical marijuana. My sister-in-law, she can't drive,
Okay.
and I'm sure she's not the only one who cannot operate a motor vehicle.
Sure.
By you being a doctor.
Yeah.
Trying to see what your opinion.
So for medical marijuana, number 1, I will say, do I care if people smoke marijuana? Absolutely not. I have no preference on whether they do it. There are some things you should know about it. It's not well studied on purpose because it's Schedule I federally still, which is insane. But if you do it chronically,
Right.
you know, so if you, I mean, some people will do like an 8th or more a day, you know, high levels.
Right.
That's not even high for some of the things that I've heard, you know, once you get into waxes and other things. But if you do smoke marijuana, it can, over time, if you do it chronically, raise anxiety levels. Other things too, it can affect sterility. So it can lower sperm counts in males. It can do things like lower seizure thresholds. So if you're prone to having seizures, and you, let's say, take a bunch of edibles, you might have one. And then you definitely won't drive in this state at least for 6 months. So can it help in the short term with anxiety? Are there different products that might help with pain, like CBD and other things? Yeah, I think so. But it's hard to know because of the lack of regulation sometimes. Anecdotally, if you have severe pain and nothing else is working and you have a product that you can put on topically, I would say go for it. But just be aware of those things. The other thing too is federally, again, it is still illegal. And sometimes they might advertise a product that has just CBD in it, but actually does have THC because they don't actually measure that and take it out. And so if you're going for jobs, and that's something that people are measuring, you want to be very aware that that is something that might show up. Likelihood it does, probably pretty small, especially if they advertise that there's no THC in it, but it's not 0. Yes?
If they had a marijuana card, would that excuse them from the job?
Not necessarily.
Not necessarily.
A lot of times it's employer specific. Like if the employer says you can do this if you have a card, maybe. I don't know of any employers that would say that, but again, it's hard to say, for sure. I think we had questions, yes?
Back to the cholesterol medicine.
Yes.
Over the years, 10 years ago, I had a heart attack. Short story. But,
Okay.
recently, back in February, I had another heart attack. It was an old issue. The stent failed. One of the stents failed that they put in.
Okay.
We had to go through the procedure again. Recently saw my cardiologist, and A1C is a little bit high, 6.7 or something like that.
Okay.
So they recommended cholesterol medicine to help. The problem I've had with cholesterol medicine is that the rovastatins or the statins
Yes.
give me joint pain,
Sure.
extreme joint pain. The only one that seemed to work was Crestor. But Crestor right now, when you describe that,
It's expensive.
the pharmacist come back and say $700 copay.
Oh my gosh.
So,
I apologize. I just have to look at my phone for 1 second. I'm getting like. Hold on 1 second, I apologize. My wife's just texting me, hold on, so I just wanted to make sure nothing was urgent. But,
So with the Crestor medicine, my question is,
Yeah.
is there something similar to Crestor with less side effects?
so, let's talk about them as a class. Yeah, you probably tried Lipitor, which is a atorvastatin. And that's something that is commonly first line because all statins are first line. There's different ones like simvastatin, but there's indications on the level of use you need. So lower level, medium, high. If you had a heart attack or a stroke, you'll likely need a high level. Rosuvastatin comes in 20 and 40 milligrams. They're both high levels. Atorvastatin, 40 and 80 milligrams are both high. Under that level is considered a moderate dose. Lipitor, atorvastatin, is cheaper. So insurance companies want you to do that first. Rosuvastatin, or Crestor, same medicine, one's generic, one's brand name, is more expensive. Now, I haven't heard that value a lot of times. Sometimes, outside of insurance, it's actually less expensive. So if you go to, like Meyer, is a key one usually. They used to have it free, atorvastatin specifically at Meyer. Now it might be $10. Rosuvastatin though, might be like 20 or 30. Sometimes insurance, it is more expensive to go through them, which seems very counterintuitive, but it's a possibility. So I would at least check on that, or talk to maybe the care navigator at your cardiologist's office or the primary care office to see if there's a way to get it cheaper. Again, GoodRx is something, but other things that you can do. Sometimes people can take something called CoQ10 to help with some of the joint or muscle aches that is a potential for a side effect of the medicine. It's usually very inexpensive, over-the-counter supplement. Something to consider trying. The other thing would be, there's something called red yeast rice. It's also in a pill, natural product. Can't tell you how much of that would help lower cholesterol. I don't know if it has the stabilization effects that Crestor, the statin class of medicine, has. Something people consider, or even like omega-3s, which are different like fatty acids that you find in fish. So like fish pills, fish oil pills, we're just eating a lot of fish as opposed to other like red meats, might be something that helps. But outside of that, those are kind of the options, unfortunately, for those things. There are other things like ezetimibe, which is another medicine that can lower cholesterol, but a big reason that after a heart attack you would want to be on it is for hopefully the stabilization effect from having a plaque break off again, essentially. It's a very good question, though. Yes?
When is the best time to take a statin, day or night?
Either is okay. You'll see nightly on most of them. And it matters more for moderate dose There's a specific study that shows that things like simvastatin, which is a moderate dose statin most of the time, is more effective at night. So I guess the short answer is nightly. If you took it consistently in the morning, is that the end of the world? No. Yes, good question though. Yes.
As we grow older, we have to urinate with frequency.
Sure.
What, you had any suggestion how you can help with that without taking medication?
Okay. So he's saying frequency of urination, especially at night, as we age. Is that correct? So what can we do without medicine? So there are some things to potentially try. It also depends on the reason for the frequent urination. So when I think of frequent urination, I think of two things mainly. One thing is prostate. Pretty much all males after a certain age, in any race, will develop prostate issues because we have testosterone in our bodies. And we continue to have it, and that's what causes the prostate to grow and enlarge. If you have ever any like blood or anything like that, go see someone. But as far as the urination goes, there's also things like sleep apnea. So if you snore, if you feel fatigued during the day, if you wake up many times a night to urinate, if you need naps during the day, something to also consider. But not drinking water like an hour to 2 hours before bed. Simple things like that might help substantially. There's also different water pills that people are on for a variety of reasons. Don't take those after 5 p.m. Even things like Lasix, which is furosemide, if you've had a heart attack or had issues like that, you don't want to take certain blood pressure medicines too late at night because it can cause you to wake up and urinate a bunch at night. You'll see other herbal supplements that might be able to help. Some of those, it's hard to recommend, specifically because I don't know how well they're regulated. So it depends on the companies and everything, but there's different like roots that you might see or herbs. I'll say if you talk to a provider about it and they know for sure that it's not gonna probably negatively affect you, then I would try whatever you think helps or you've seen help. But I think water also too, if you have sugar issues, it might cause you to pee a little bit more, even at night, but usually through the day you might feel more thirsty. Trying to cut out later night water would be the first step that I would do. That's a good question. Any other questions?
I've been taking 81 milligram aspirin ever since I was 40 years old.
Sure.
And I do that because genetically is something that's in my family. It's hereditary, but they have heart attacks and strokes, and that really helps.
So he's saying he takes aspirin, 81 milligrams a day, which is like the quote-unquote baby aspirin does, because of family history of heart issues. Does it help? Short answer is yes. There was a recent study, recent is in like the last year or so, that recommended should the general population be on an aspirin after a certain age. And the study concluded, just for the general population, no. Because aspirin is a medicine that affects platelets. It's an anti-platelet medicine. It helps with pain too. But that's the reason that people get put on it, especially to prevent things like heart attack, stroke. Because if your platelets clump together, that can form a clot. And if blood can't get past that clot, then everything downstream of that becomes ischemic or dies off, lack of oxygen, because the blood's not getting there. So people with diabetes or blood pressure issues, or a strong family history of heart issues, after you reach the age of 40 or 50, might want to think about being on an aspirin. This is, again, everything is a risk versus benefit. You have an increased risk of bleeding. So if you have bleeding issues, or if you start and you have blood in your stool, or you have nosebleeds that are super frequent, things like that, is it worth having all of that bleeding versus the risk of stroke, heart attack? It's hard to say. You know, there are different scoring calculators. There's things called HAS-BLED and CHAD-VASc2 that can give you percentages, not just with like heart attack, stroke, like the ASCVD, but risks between the two and what is more likely. But ultimately, I don't know for sure, is the short answer. I would say if I personally had a strong family history of heart attacks, and I had blood pressure concerns or diabetes or cholesterol issues, then after I turned maybe 50, I'd strongly consider starting a statin for myself, or an aspirin rather, once a day. Yeah, absolutely. Yes.
Can you talk about the 3 P's of diabetes?
The 3 P's of diabetes. I'm not sure if I'm familiar. Can you tell me what the 3 P's are?
Polyphagia, polydipsia, polyuria.
Sure.
These are the classic signs of a diabetic.
Yeah. So, polyphagia, polydipsia, polyuria. So that means excess, right? So excess urination because of excess thirst and eating, really. If you notice that you become extra thirsty, like you might have just been going along, but you're like, wow, I need to drink water all the time. I need to drink water. If I don't get a cup of water right now, I feel like I'm parched. My throat is so dry, things like that. And then because of how frequently you drink the water, but also in diabetes, a lot of times you will leak sugar into your urine. When you have high sugar levels in your blood, your kidneys usually absorb them. But sometimes if you have it for too long, if there's a little bit of kidney issue, it can leak protein and sugar. And if it leaks it, water follows because of what's called an osmotic gradient. And it basically means that these things soak up water. If you eat some carbohydrate, if you imagine pouring water into like a hot dog bun, like bread, soaks it right up. It's exactly what sugar does. If it leaves in your urine, it brings the water with it and causes you to drink more. And then usually you also get excessively hungry because of increased levels of insulin that are produced in response to trying to get your sugars down. So if you notice those things, I would absolutely go see somebody and talk to them about that. Because, again, you might not feel these things. Sometimes you might not have those symptoms. And it's just something that they'll know tomorrow if they do a blood test. But that's a very good question. Yes?
Once you kind of summarize as means, what is the best way to take care of ourselves?
So I would say, as men, the best way to take care of ourselves, number one, is try to stay active. Try to stay active. You know, eat as healthy as you can. Is it okay to have a cheat day once in a while? Sure. But limit how much portion you use. Limit how much carbohydrates you take in. Things like bread, pasta, rice are great, but replace those things sometimes with more plants. That's frankly one of the best things you can do. If you have family history of blood pressure issues, cholesterol, things like that, or even if you don't, I would see some provider and at least get a yearly checkup. And they'll talk to you about any other screening thing that might be worth it to take place. And kind of go from there. But outside of, eating well, exercising, also, if you have mental health concerns, please bring those up with someone as well. If you feel like you're gonna harm someone or yourself, one of the strongest things I think a person can do is seek help. But doing those things, keeping your mind right, making sure that you're up to date with, as far as any screening things that can be captured early and intervened on, either by, not even with medicine, but by making lifestyle changes, is probably one of the more effective things that you can do for staying healthy and then living longer.
Okay, any questions?
And that last one question. Now you can see why I'm so healthy. So I used to kind of tease him and said, why am I getting so much attention? And you say, well, because I got good insurance, but no, he's a good man. And he knows what he's talking about, and he's very relaxed. Many times when you go into see a physician, they hurry in and they hurry out, but he's not this kind of person. And he knows what he's talking about. And maybe we should, every 6 months or something like that, sit down and kind of talk. Because things are getting pretty tough when it comes to taking care of your health and making sure that you living the way you should live. Any last minute questions? Yes, sir.
Something that irritates me lately about doctors, in the same way you call yourself a provider. You're a doctor. You work hard and earn that degree. I understand that in your office, there are physicians, assistants, and nurse practitioners. But that's what they are. Call them what they are. Call yourself a doctor. Take the title, take the credit for it. I've got you work years and years for it. And you should get the respect you deserve for what you've done.
Amen.
And as I said before, we won't hold it against him since he graduated from the wrong school. Pretty soon, Michigan will be playing Ohio.
And Eastern will be playing Toledo, so we got two strikes against him.
But he does a very good job and take care of me. And we went through it. We talked about having a lower GI and stuff like that. It's not bad much. In fact, I had one this week. And the doctor is saying I don't have to see him again for another 3 years. But the worst part of it is that you have to drink all this stuff. But it was worthwhile. And I think we probably should take it. And they told me every 10 years, but they found some power. So we took 6 months ago, and then they followed up on it, so I'm in real good shape. But I encourage each one of you to see your physician. And even if you don't have adequate insurance, as he has mentioned, there's ways you can get around that or something. And especially we need to, we were talking about, I'm not a vegetarian, but I don't eat meat and stuff. And I found it's much better for my intestine. It's easy when it comes to my digestive system and so on. So we're going to try to have something like this regulars. Some of the ladies, when I told them we're doing, they said, I need to get my husband there because he won't go to the doctor until he's almost dead. So we appreciate you coming. And what size shirt you wear? Ken, do we have what size? We got a.
Mine now, extra large.
What you wearing? What?
Probably extra large.
bring him up here, we're gonna put it on.
This is one thing, I don't know if they have other organizations here, but they have a place called St. Luke on Seymour Road in Jackson, Michigan, where they have retired doctors that came together, and they would take care of you at no charge. They medicines, they prescribe is at no charge. They take care of the people in Jackson.
Well, as I mentioned earlier, I was telling him, a while back about the project we'd like to try to get into. And I said, unless the situation change, I'll be willing to donate a day, a week to go in and talk to young people and so on. So we appreciate him trying to help individuals. And now, like I was saying earlier, is that we need to learn how to take care of ourselves as men. Usually, we die maybe 5 years of earlier before our spouses, but we want to try to be here. I think we learn how to take care of the Lord body, which this is his vessel. And stop putting all kind of stuff into it. But again, we appreciate you coming down. You just had a baby, what, it's 10 months old now?
Yeah, 10 months.
Been married a short time. We're gonna be praying that you be married 45 years, 50 years. Okay. All right, give it up.